This is Heart Rhythm TV, breaking news. I'm Clinton Thurber. We are growing as a Heart Rhythm TV crew. We've recruited some new blood, some new energy to our squad here, and I'm here joined by Mehak Dhande, one of our new recruits. Normally at this point I would introduce our guests, but that's the whole purpose of our segment today, so I'm going to let Mehak do most of the talking. So starting off, tell us about yourself.
For sure, it's great to be here. Thank you for having me. I'm excited to join the team. My name is Mehak, as you heard, and I'm from India originally. Went to medical school there, and then my family moved to Vancouver, and I thought that wasn't complicated enough, so I moved to Boston for for internal medicine and cardiology training, and currently I'm an EP fellow at University of Pittsburgh Medical Center.
Okay, great. First year, finishing first year.
First year, yeah. And outside of my professional identity, I like to write. Run, and ever since I married an upstanding Austrian gentleman, I also ski. At the age of 32, who knew you could learn how to ski at the age of 32?
Yeah. Plenty of new tricks in EP too, so keep that learning curve.
For sure.
We've learned recently, there's been a study that's made a lot of noise, identifying how unique it is to be a woman in EP. The stat that's been thrown around this week is 5%, and how we need to get better at that issue. What is entering EP, breaking that culture, what has that been like for you? And I guess, without regard to gender, what attracts you to EP?
For sure. I mean, thanks for bringing that question up. I think it's so important to talk about it. The study by Dr. Howell and also some of the abstracts presented yesterday by Dr. Butnam and Dr. Tedrow, I think they really shine light to this really important topic. And it's unfortunate that I'm unique by virtue of my gender in EP. EP in and of itself is a fantastic field. Amazing procedures, diverse range of procedures, the range of research opportunities so diverse that really you would have to convince someone not to do EP. So it's surprising that we don't have enough diversity in terms of women in EP. So for myself, I would like to say that even though having female role models was difficult and few and far between just by the virtue of numbers, the male mentors and sponsors I had throughout were very encouraging and really supported my career. So I think that is the beauty of EP, I think, is that both the male and female electrophysiologists realize that this is a problem, and they're committed to changing it. And so I think in the future, I mean, it'll take time, but I see this paradigm shifting, especially if we start recruiting women early on. Every time you see a med student or a resident or fellow interested in EP, just gotta show them the light and support them. And I think with due diligence and the right policies and recruitment strategies in place, we will make this change.
Yeah, we've got to do a better job publicizing, I think, to everyone.
For sure.
Early on. I like all those things.
Yeah, EP is easy to sell, so we just got to do a better job of selling it to the ladies.
Yeah. Now for the serious questions. Very hard-hitting stuff here. But do you have a pet?
Yes, I have a delightful 6-month golden retriever.
What's your golden retriever's name?
Her name is Archie.
Archie, okay. If Archie could speak, what would she say about you?
Oh, gosh. She would say, thank you for all the food and treats and belly rubs. Love that. But I think she would also say, can you stop picking me up? Because she's 6 months and 40 pounds. And she would say, frankly, it's a little unnatural. Stop picking me up, please.
A lot of big dogs think they're little dogs and love to be picked up. She's self-aware, I guess, huh?
She's a darling.
What is your strangest irrational fear that you have?
Such great questions. That I will fall asleep one night and all my teeth will fall out in my sleep.
I've heard that before. I actually had that dream for the first time in my mid-30s.
Was it terrifying?
It was terrifying. Yeah.
I can imagine.
I was so glad to wake up that day. All right, so we've all walked into the EP lab ready to do our procedures and help patients. I would even venture to say a lot of us have heard some music in our head as we walk in. If you have a theme song that could play when you walked into the EP lab, what would it be?
You would think I haven't thought about this, but I've thought about this.
We all think about this.
Without a doubt, my shot, Alexander Hamilton.
Okay.
Any day of the week.
A little Broadway in there and
100%.
High society. Good.
Yep.
That's awesome. All right, so Jeannie shows up in the EP lab. grants you one item that you can have an endless supply of, EP related or not, what would you choose?
It would have to be time. Yeah, not to shift the conversation to a very philosophical point of view, but I think for myself, family, friends, patients, you name it, oodles and oodles of time.
That's a good one. Yeah. Broadly applicable. So there you have it. Mehak Dhande joined the Heart Rhythm TV crew. We're happy to have her, lucky to have her. And thanks for tuning in with us. Breaking news.
Thank you.